Hi, this is Tom Seco with iTentive Healthcare and wanted to take a moment to thank you for joining our webinar today. Just a little bit of housekeeping. This webinar is going to be recorded and everybody's phone will be muted as well. Any questions that come up, we'll answer any questions at the end of the webinar. So thank you for joining our webinar today about automating patient credit balances in NextGen. We have some exciting news to tell you. iTentive is now part of the DAS Health company. We merged on November 1st, and now we're a member of company of the family. So that being said, our passion is to provide solutions for our healthcare partners, help them improve patient care, help them enhance the patient experience, and help them maintain a financially healthy practice. We've been doing this since 2003, and during this time frame, we have worked with over 375 to 400 clients that use NextGen, and we provide services in the consulting area, hosting services, customization services, and productivity tools, two of which we're going to talk about today, Unapplied Deposit Manager and RefundManager, and some of our other tools like ChartGuard and Multiple Encounter Billing Manager are some of the other tools that we have developed over the years as well. So as I mentioned, my name is Tom Seco. I'm the Business Development Manager with iTentive, and with me on the phone is Joe Scholes, and Joe's our Vice President of Product Solutions. This is an agenda of what we're going to cover today. We're going to talk about co-pays and deposits and unapplieds using our Unapplied Deposit Manager software, and then managing line item credits and refunds using our RefundManager software. As I mentioned, we'll answer any questions that you have at the end as well. So basically, there's two types of credits that we have to process, line item credits and unapplied credits. Line item credits typically occur because of overpayments or erroneous adjustments, and unapplied credits typically occur when you receive money in advance of a service being rendered, such as co-pays when you take them prior to an office visit, because there is no encounter for it to be applied against. Sometimes you take deposit money for a surgery or for a diagnostic procedure, and again, there is no encounter to apply it against, so those monies get categorized as unapplied money. Also, when you collect payments through third-party kiosks or tablets or services where you're taking money, and again, there's no encounter to apply it against, so it comes across as unapplied money. So as mentioned, we're going to talk about our two products, the Unapplied Deposit Manager and RefundManager. This is kind of a busy slide, but really what it's showing is that the Unapplied Deposit Manager software deals with the unapplied credits at the encounter level, deals with the unapplied credits at the account level, and also helps you more effectively and easily manage deposit money for specific procedures and as I mentioned, surgeries or diagnostic procedures. The RefundManager software deals with the line item credits and allows you to manage those credits effectively, creating refunds or maybe distributing those credits to encounters that have open balances on them. We integrate with your accounting application, so it makes it much easier to print refunds, refund checks. And then at the end, we bring that refund information or refund check information back over into NextGen and update the patient chart there. So with that, I'm going to turn it over to Joe, and Joe's going to take you through a demonstration of both products.
All right, great. Thank you, Tom, and thank you everyone for joining us today for our short webinar on Unapplied Deposit Manager and RefundManager. We're going to switch screens here over to our demo machine, and then I'll spend a majority of our time today showing you how these products work. So bear with me here. Tom, can you do the other one?
Yep.
Thank you. There we go. Okay. So now you should see NextGen Practice Management in the background. By the way, if you have any questions during this, please type it into the question panel in the GoToWebinar control panel, and then we'll jump to those at the end. But that way you can type them in as we cover things and as you're thinking about them. So let's jump into the Unapplied and Deposit Manager. We're going to cover that first and then Refund Manager second. A couple differences between these tools. The Unapplied and Deposit Manager is a rule builder, and you're going to build the instructions for one or more overnight jobs that are going to run and process your unapplieds in the way that you need them resolved based on your current situation. So this tool, you'd only give to one or two people to build these rules so that you don't have too many chefs in the kitchen doing things that conflict with each other. So you'd build out the rules, and then the rules would just continue to run until such a point where you need to modify them, or maybe you need a different rule to do something else. And I'll take you through that in a minute. But the Refund Manager, which is our line item credit processing tool, is more of an interactive tool. So if you have 5 people in the business office that are working credits, line item credits, you'd probably give this tool to all of them. So it's at your discretion. So jumping in to the Unapplied and Deposit Manager, let's look at what you can do, some examples, and how you build out these rules. For our demonstration today, I've built out 4 different kinds of rule sets based on the goals that we're wanting to accomplish. The tool is not limited to these rule sets. It can do more than this. This is just giving us something to talk about so we're not sitting here watching me build these from scratch. This first example here, copay cleanup, we run into that quite often in the unapplied world, where you have a lot of encounter unapplied amounts that are even dollar amounts that were copays taken in, but your insurances weren't set up for that. So clients come to us and say, hey, can you help us with this? Now, a number of years ago, we used to write custom database scripts to clean this up, but as we created and matured the Unapplied and Deposit Manager, we were able to build this type of processing into this tool so that you can control it, you can run it as often as you want, and you manage it. So if we look up here, we have copay cleanup selected. And then down in the instructions, these just read left or right. Think about if you were instructing your team on how to do these, and you'd write out the instructions. This one, if the encounter unapplied equals specific amounts, apply it up to the unapplied amount. And those specific amounts are defined here in the pop-up column where you get to enter those. So based on the type of parameters needed for the rule, it'll give you the right kind of entry widget. So in this case, we've specified 5 different amounts. You could have 1, you could have 10. It's really up to you. But this one line here really becomes your copay cleanup. And over here on the right, we have a summary that pulls it all together. So we're just kind of building the sentence left to right. It's that easy. Now, a little more complicated one that we see is clients coming to us and saying, you know what? We have several $100,000 of unapplied money out there. We've been taking payments for whatever reason. It's been getting posted to encounter unapplied, some of it to account unapplied, and we're way behind on this. The patients are screaming at us because they're getting statements showing money due. Finance is screaming at us because the accounting's not right. We're on a mission to get these unapplied balances resolved. So this one has a number more lines in it, and I'll take you through real quick how these work. We'll hit on some of the key instructions here for this rule set. And again, just like before, we build these out left to right. They read left to right. Encounter unapplied equals patient amount. Apply it up to the patient amount. We can do this today in NextGen. But what about if it's greater than the patient amount? Well, as we're building this, we can select, do we want to just apply it up to the patient amount, leaving money in encounter unapplied that we'll take care of later? Or do we want to over apply it by applying the whole unapplied amount? In which case you'd have a line item credit and maybe you'd use RefundManager then to refund that back. In this case, we're going to leave the money in encounter unapplied, and I'm going to show you what we'll do with that in a moment. If we're doing equals and greater than, what are we doing for less than? Well, again, if encounter unapplied is less than the patient amount, apply it up to the unapplied amount because we can't apply it up to the patient amount because it's inherently less than. And this last one here is going to resolve our issue with that greater than, where we might still have money sitting in encounter unapplied. And if you put list line in here, you build out this instruction. It says encounter unapplied remaining amount, move it up to the account. Why would you do that? So that you can use it on other encounters where money's owed. And I'll show you where that happens further down in the instructions. Now these encounter unapplied lines show you what it's going to do, what it's looking for to match with that unapplied amount. Now we can refine that by using scopes. So in this case, I have an encounter scope that says skip encounters with no charges. That way, if the unapplied money is out there and the charge didn't come over till the next day, we're not moving that up to the account. We're waiting for those charges. Again, you may use that line, you may not use that line. Encounter scope, let's wait till the insurances equals 0. And this gives you the best depiction of what the patient balance will be once all the payers have contributed their money to the balance, what's left for the patient to pay. So these instructions, again, we're just building them out. We'll help you in your test environment get started. We'll sit down with you and talk about what it is you're looking to accomplish. Account unapplied. So we've done the encounter, we've maybe moved some money up to the account, maybe we also had money sitting in account unapplied. Well, we have instructions for that too. Account unapplied remaining amount, let's find the oldest balance and walk it forward. And then what happens if there is no balance and there's just money sitting out there in account unapplied? Well, we have a rule to help you there too that you can put in, which is the remaining amount, wait for it to age, and then create a new encounter. So you specify the number of days you want it to just be stagnant out there, no new appointments, no new encounters, no new transactions. Once there's nothing happening for that number of days, create a new encounter, and in your file maintenance, you define a dummy service item and push the money down onto that, and then you could refund it out now that it's a line item credit. And again, we have a similar line here for the insurances being 0. Normally you'd build these rules, you'd set it how often you want it to run, and then you'd hit save, and the BBP job would kick it off each night and do the processing based on what you've built out. And you could have several of these rule sets running concurrently. In the case of testing, you don't want to wait till overnight, so we can do a quick run where it'll just execute it for several minutes, and then it'll show you the results, the transactions that it put into your batch in NextGen on your behalf. All right, last thing I wanted to cover before we move on to the Refund Manager is what about deposits in Unapplied? Okay, we have some clients that take deposits and tag them on an encounter for future use. We have others that take it straight into account unapplied. Well, the great news is this system can manage that unapplied deposit money for you. And the special thing about unapplied deposit money is it's really intended for a specific future service, but NextGen doesn't really track it for that. It just ends up in the realm of unapplied, and then you have to make notes or use dummy charges or some way to indicate to your staff what this money is reserved for. So in this case, we just build out a cross-reference of transaction code used to intake that payment for unapplied versus the service items it can be used for. So if I look here in our fertility scenario we have set up here, we've taken the money into unapplied using the transaction code patient deposit fertility. We give it a name over here. And then over here on the right, we have one or more lines that use that name, and then we can assign it individual service items. So if there were 5 of those, we'd have 5 of these lines with fertility deposit. Or if they're all in the same modality, you could go that route and just maintain the modality. Or you could do a mix of them like we have here. But the cool thing is this saves you having to track that money for deposit. This system will do it, and you just let it manage your unapplied. It'll see the money come in, it'll log it that it's reserved for a specific future procedure, and then it'll keep watching the patient or the account for that future procedure coming up. So how easy is it to build these rules? If we were sitting down with you and had this installed in your test system and we were getting you started, we'd go ahead and define what the rule is going to do, give it a name up here. And then down here, we can go ahead and build out what these are. And we have some templates to get you started and put some of the basic stuff in there. And then we could go ahead and add something like encounter scope. Yes, I do. It sorted them into the right order. So we can add something like encounter scope and limit encounters to, transaction codes, providers, locations. Maybe we're testing it and only want to work with a specific provider. So we can go ahead and pick that provider, and that's it. We've built a rule. So you're in charge of this. You get to build it, control it, turn rules on and off, and resolve your unapplieds. We'll be there to support you, but the whole key is to put this power into your hands. So let's switch gears real quick and talk about line item credit balances. So far we've been talking about the unapplied credit balances. Let's talk about line item credit balances. And as Tom mentioned, these are credit balances that result from overpayments, bad adjustments, bad posting. Maybe all the money was put on one charge when it should have been split between several charges. The Refund Manager is an interactive tool to help you through that. It'll look for line item credits. It'll process them. It can move them around between charges, between encounters, even between practices if it's under the same guarantor. It can then export out the ones that are refunds to your accounting solution or to your bank. We have about 18 different formats that we support so far, and we're always looking at new ones. And then we can pull back the check information once those refund checks are printed. And the cool thing about this is it saves tons of data entry. You're not having to create NextGen transactions. You're not having to key everything into the accounting system. You're not having to key the check information back into NextGen after the refund checks are printed. So real quick here, we're going to go through the Credit Scout, which is your NextGen facing piece, finds those line item credits. You can move them around. You can mark them for refunds. Once you have some that are refunds, you want to get them out to have the checks printed. That's what the batch detective will do. It'll find refunds that were either done automatically in RefundManager or manually in NextGen. It doesn't care. A refund transaction is a refund transaction. It'll push them out to the accounting solution, and then the importer, which will bring back that check information. So I'm going to go here, and normally as our best practice, we recommend finding credits that are good candidates to be moved around first to be distributed, because we want to keep that money in the practice if we can. Now this functionality is only for patient credits because of all the rules surrounding insurance credits. So there's a couple of these I want to pick on here before we go and do the refunds, and I want to show you how we can move these around. What we're seeing here on each line in this grid is the guarantor and the amount of credit underneath it. We can expand these out to see more information. So under the guarantor, we have the practice and account. We have who owns the credit. It could be the guarantor. It could be, if it was a refund, one of the insurances. We have the encounter with the credit, and then we have the charge with the credit. Now this is great. It's showing us there's a credit. How do we get more information? Well, there are several tools built in that mimic screens in NextGen. So it's kind of like a drill down. So we can click here on the encounter number, and we can see the financial view. So we can see, yeah, there are a couple of charges, there's a payment. Gosh, it looks like it should total out. Why do I have a credit? So let's go to the charge ledger, and then we'll see, well, here, $95 charge, there's a $50 credit. So obviously they put that whole payment against that first charge. Maybe the second charge wasn't out there yet, but now we need to go ahead and move that down to the other charge. So we simply just tick the distribution checkbox. It's that easy. When you give it the go ahead, it'll create the transactions for you to move that money around. Let's take a little more complicated one. Let's look at Oscar here and see what's going on. So Oscar has a $295 credit. If I want to see what it thinks it's going to do, I can do a distribution preview. And I can look and go, okay, we have a $295 credit. It's first going to take 236, move it from encounter 1213 to 1214. Sounds good. Then it's going to take the remaining 59 and move it to encounter 1215. All right, so it's just these left-right pairings. If I want to change the order in which that move is going to happen, say I want to pay 1215 first, we have a screen where you can match up the left and right side. So in this case, I'm paying $12.15 first, and then I'm going to partial pay the other one. We had clients who came to us and said, you know, we like the oldest to newest, but there are some cases where we know the money was intended for something specific, so we want to go ahead and override that. So now we've picked a couple of these as distributions. All we had to do was tick the check mark, and to create the transactions, we tell it to process these, and it'll find the ones that are checked, and then it'll go ahead and create those transactions. All right, so it was that simple. The system did the heavy lifting. If there were, 30 of these, it would be about as fast. So after we've done that, we can go through and look for our candidates for refunds. So the best candidates for refunds. And we'll take a look here. This time we'll pick on Jennifer down here at the bottom. And Jennifer has several encounters. So if we want to see an account view to get an idea what's going on, in addition to clicking on the encounter number and the chart, basically the service item, we can go ahead and pull up screens that mimic the financial summary and account summary to see what's going on. And in this case, we'll sort it a little different. We can see there's charges, there's overpayments, and there's no adjustments really to factor in on this one. So it truly is an overpayment. So in this case, we picked the R checkbox for refund. Now I'm going to pick a couple more of these just so we have several to send through here because we're running tight on time. This one up here is an insurance refund. So the system for the refunds can do both insurance and patient refunds. Just like before, we're going to right mouse, tell it to process. Yeah, let's create those refunds. And boom, they're in NextGen for us, part of our batch. They're on the encounters. So now if we come over here to NextGen and find our batch that we've been using for the refunds, I'll go ahead and balance this out and we'll post it. And then we'll walk one of these through the accounting system. Like I said, we have about 18 accounting systems we support. In the demo environment here, we're using QuickBooks, which is a popular one out there. All right, so in our batch, we have our 3 distributions down below. It was a plus and minus of the same amount, net's 0. Here's Jennifer's refunds down here. We can see those. We can see our insurance refunds up here. So now let's go see what's happening in RefundManager. I want to go into our batch detective. I want to find those batches out there that we haven't processed yet that contain one or more refund transactions and send them over to QuickBooks. In this case, we just have the one we've been working. And instead of us having to type it into the accounting system, we tell it to export, and it'll either generate a file for your accounting system or talk straight to the accounting system, depending on what accounting system is in use. So it just moved all those refunds, all 9 of them, over into QuickBooks without accounting having to data enter it. So accounting loves this because they come over here, review their batch of checks that they have out there, load their check stock. We can see these are all pending to be printed. And they save hours each week getting out of the data entry business. So now that the checks have been printed, they have check numbers assigned to them. So we want to go ahead and pull these check numbers back into NextGen, and that's equally as easy. We come back to RefundManager, we find our exports that we've done using our import tool, and we either tell it to talk straight to the accounting system or to browse for a file that was given to us by the accounting system and import that in. So I'm going to right mouse import. It found all 9 of them, it updated all 9 of them. What does that look like in NextGen for you? So we'll go ahead and pull up one of Jennifer's encounters here. And I'll show you what it looks like. The first thing we're going to go through is there were a couple encounter notes created for documentation for you. So when RefundManager created the refund transaction, and then another one when we exported the transaction. So that way, if you're working purely on the NextGen side, you can see what's been done and you can see it was sent over to the accounting system. And then last, because we did that import after the checks were printed, we now have the check number, check date, check amount, and this one was a total check for all three of these refunds, so it's a little more without having to key that in. So both of these are productivity tools designed to help you solve your credit issues in NextGen. The Unapplied and Deposit Manager for your unapplieds and the Refund Manager for your line item credits. I'll turn it back to Tom and we can see if we have any questions.
Okay, thank you very much, Joe. We do have a question. Is Workday one of the accounting softwares that you support?
Workday isn't today, but if they have the ability to read in flat files, comma separated files, we can work with you to come up with a format that can operate with Workday. And then we'll give you specs for a report to run out of Workday to give us the check information. That's normally how we get started with these newer accounting systems that we run into.
I have another question along the same lines. Can you integrate with a Billa accounting application?
We actually do integrate with Abila today. We can generate the files, including the data files and definition files that are needed to be able to import into Abila. And similarly, we'll give you the output for the report that we need out of Abila to read back in the check numbers.
Here's a question with regards to unapplied. I have a large backlog of unapplied money because of our third-party kiosks. What is the best way to eliminate that backlog and then keep up with it on a daily basis?
If you're using Unapplied and it's coming over through your kiosk system, it's just like those rules we looked at earlier. The difference being normally what you do is limit it to transaction codes coming in over Rosetta that are coming in from your kiosk system. And then you can set that equal than, greater than, less than rule to that. And that'll just keep running each night and updating the money that comes in from your kiosk and making sure it's getting applied to those charges. So even if your staff is doing it today, it's kind of a nice fallback to know that it's going to get taken care of even if the staff doesn't get to it.
Okay, I have another question. We have 4 layers of security. Can you get past that?
I'm not sure I understand the question on the 4 layers of security, but let me go ahead and just throw out there's security built into these tools so that if you need to be in the right NextGen groups to be able to operate them, RefundManager has additional security. Plus, you're limited to the practices you have access to in NextGen. And obviously, for the accounting system, you need to be set up to integrate with that and have credentials there. So there's multiple ways to secure this, and as part of our implementation, we'd have a kickoff meeting and kind of decide on all those parameters. What does the security look like? Who's going to use it? What's your accounting system? How are we going to integrate that? So we'll take you through all this and help you get installed in your environment.
So there's clarification on that. They have 4 layers to get into their accounting system.
Okay. What we normally do then is generate a file, and then the person with the right security on the accounting side would import that file. So they'd go through their security to make that happen, and then they'd run the report and bring that over. If the accounting system is remotely hosted, normally you have things like network drives or client map drives to kind of move those reports back and forth. Again, stuff we've run into before, and we can certainly help make recommendations in your environment.
Another question, can I have one person request the refund and another person approve the refund?
You certainly can. There's a couple ways of doing that. One is to split out who does the export from who creates the refund, so that gives you control. If you want to go a step further, we can set it up so that there are different roles in RefundManager. They're referred to as requester and processor, and the requester people would then just generate those basically requests using the NextGen work log for refunds, and then the processors would approve them or deny them, and if they approve them, they turn into refund transactions.
And then what is the implementation and training process for the Unapplied and Deposit Manager software?
Okay. Both tools are fairly similar in their implementation and training process. Again, we'll start with the kickoff call, pull in the appropriate stakeholders, figure out who we need to work with for which pieces, right? Getting integrated with the accounting system, GL codes, mappings. If it's the unapplied, what rules you want to tackle first, what your biggest problem is in the unapplied world. And then we'll give you some training materials, which will include video and user guides. And while you're looking through that, again, you don't have to memorize this stuff. It works fairly straightforward. But while you're looking through that, we'll work with your IT to install in your test environment. And then when it's available in your test environment, we'll do 1 or 2 Q&A calls with you where we'll actually walk through the process from beginning to end. Then we'll set you loose to kind of test and build. And during that time, you'll have direct access to your analysts that you're working with. And when that's done, we'll go ahead and repeat the process in production so that you can start using this in your live environment.
So
Go ahead.
I'm just looking at there's one other question here. We normally call patients to be sure the address on file is accurate before mailing. Would you be able to still do this process?
Yes, you can still do that. Obviously, you want to make sure your data in NextGen is good. Depending on the type of specialty you're in, it may vary as to like if you're sending out statements, are they going to the right address, things like that, or are you just taking credit card payments and then the address isn't as well defined. So again, that's a good process to have, is to make sure your addresses in NextGen are good. So you can definitely still do that.
And a follow-up question, I am assuming if you stated that one can import the file and the other approves it.
Yes, yes. So you can do that, yeah, on the NextGen side, which is probably where you'd want to do it to make sure you have good data, but you could do it on the accounting side too.
Okay. And I think you answered this question before. I have 2 practices set up in NextGen. Can I keep the views of certain people to just one practice and not the other practice?
Yes, you can. The permissions in RefundManager are set up based on your NextGen permissions, so that if you have permissions for both practices, you'll be able to work in both practices. But if you only have permissions for one practice, you won't see the other practice.
Okay. Well, I know it's past our time at 12:30, so thank you for asking all of the questions that you asked, and thank you for taking the time to learn more about our software and how it can help you make your job easier and more productive. So if you have any other questions, please give us a call or send us an email and we can answer any questions that you have. With regards to next steps, if you have an interest in learning more about either product or both products and how they would fit within your organization and how you can gain benefit from both products, again, call myself or send me an email, or call Joe and send him an email, and we can get a further discussion set up with you. Thank you very much for joining our webinar today.
Thank you, everyone. Have a great day.